In this video, we'll be covering Mycobacterium tuberculosis. We have a lot to cover in this story. A lot. Like, if you're planning on watching it all in one sitting, I'd consider DVT prophylaxis. But we did try to pick a theme that would keep it interesting. It's a story that takes place in the Wild West, and it's called Shootout at the TB Corral. Let's start off by drawing the scene's background and talking about some general characteristics of Mycobacterium tuberculosis. First of all, you should know that TB stains acid-fast. This means that it takes up carbofuchsin stain. Our symbol for acid-fast, if you remember from the Nocardia video, is the acid-fast quick-draw gunslinger. Recall, however, that Nocardia is only partially acid-fast, but TB is the real deal. So let's draw our acid-fast gunslinger over here behind this cart. The reason that TB is acid-fast positive is because of the high concentration of mycolic acids in its cell wall. These waxy, fatty acids take up the dye and trap it, and prevent it from being washed out during the rinsing phase. To help you remember this, we're going to use the same symbol we used in our Nocardia story, the two branched tassels. We're going to have them coming off of our acid-fast cowboy's shawl and chaps. Remember, we chose to use the two branched tassels because they look like the two waxy side chains that mycolic acids are composed of. Finally, just to really make this stick, we're going to give our cowboy's gun and holster a fuchsia color. This should help you remember the carbofuchsin stain. TB cultures very slowly, requiring anywhere from 2 to up to 6 weeks for growth. They also require a special growth medium, which is called the Lowenstein-Jensen medium, and it's composed of starch, egg, and other ingredients we don't need to know that inhibit the growth of other bacteria that may be present in a patient's sputum. To help you remember the special auger, we're going to name our building here the Lowenstein General Store, for Lowenstein-Jensen. I think it really does sound like an old Western store. Another important characteristic of TB is that it's an obligate aerobe, which is another way it's like Nocardia. To help you remember this, we'll use the same symbol we used for obligate aerobe in the Nocardia video, which is air bellows. We'll have a sign up here on the general store advertising that they have some air bellows in stock. Again, this is for obligate aerobe. We're going to stop talking about virulence factors for just a second to talk about transmission, which is key for our understanding of other virulence factors. TB is transmitted from human to human through respiratory droplets. Once it's infected someone and fails to be immediately cleared by the immune system, the microbe primarily resides and proliferates in macrophages. To remember this, we're going to draw a cart here with the macrophage cage that we originally used in Salmonella. We'll get back to the progression of the disease in a bit. We've still got a few more virulence factors to cover. Aside from mycolic acids, the Mycobacterium cell wall also contains some glycolipids that are involved in the clumping of the bacteria into a serpentine-like formation. These structures are essential for virulence. If a strain doesn't form these serpentine shapes, then it's not virulent. Another name for these structures is cord factor. So what exactly does cord factor do? Well, it has several functions, but its role is to protect the bacteria from being destroyed. It does this through eliciting granuloma formation by increasing TNF-alpha and other inflammatory cytokines. This will, in turn, activate other macrophages. Wait, what? How does this protect the bacteria if it's activating the immune system? Well, sure, the bacteria can't spread anymore, but it also allows the bacteria to remain walled off inside a granuloma, which is created by these newly activated macrophages. To remember the cord factor, we're going to give our cowboy a lasso. This shape should help you recall the serpentine shape of the cord factor. We'll have him wrapping up the driver of this macrophage cart to remind you of its interactions with macrophages. The last virulence factor we're going to discuss are sulfatides. These are actually what allow TB to survive inside cells like macrophages. These sulfatides prevent phagolysosome fusion, thus sparing the microbe from exposure to lysosomal hydrolases. The sulfatides accumulate in the phagosomes and create incompetent secondary lysosomes, which are then unable to fuse. To help you remember this, we're going to draw different sized dust clouds here behind our cowboy. We've placed them near these spurs on his boots. The spurs are supposed to represent sulfatides, and these dust clouds are the lysosome and phagosomes. that are kind of floating around on their own and not coalescing into one big cloud, or phagolysosome, which is what happens when TB accumulates sulfatides. And that should be strong enough to help you recall the mechanism of this virulence factor. Okay, now that we've covered the important virulence factors, let's go through the progression of TB. Once someone's infected by TB, they have what's known as a primary infection. After this primary infection, there are essentially 3 different outcomes. One is a healed, latent infection. Another is that it can cause a systemic infection that can be particularly severe. And finally, the third possibility is that an infection that once was latent reactivates later in life. Okay, let's talk about primary infection first, which affects the lungs, and is primarily either the lower or middle lobes of the lungs. After the primary infection heals, the lesion becomes fibrotic and eventually calcifies, as do the nearby draining lymph nodes. And together, this forms what's called the Gone complex, which are visible calcifications of the lung parenchyma and hilar lymph nodes that can be seen on chest x-ray. We're going to help you remember all of this with a cactus. Let's draw it back here on the left. We tried to make it look lobular, like lung lobes. Notice 3 lobes on the right and 2 on the left? We have bullet holes here going through the middle lobe to remember where primary TB occurs. We've also added red cactus fruit here in the region of the hilum to help you remember hilar lymph node involvement. And to remember that these signs together are referred to as a Gone complex, we'll make this building behind the cactus a gun store and call it the Gun complex. TB specifically creates the caseating type of granulomas. You should have learned or will learn about this in your pathology course, but just to review, granulomas are basically formed in an attempt to wall off an area of infection. They are characterized by a collection of activated macrophages, or Langerhans giant cells, and in the case of tuberculosis, there's a central area of caseating necrosis. These granulomas often develop fibrosis and scarring. And another name for the granuloma surrounded by a scar with a central area of necrosis is a tubercle. To remember caseating granulomas, we have these carts on the left and the right of the drawing that are broken down. Remember, we said that these carts represent macrophages? Well, the broken carts that are falling apart represent necrotic macrophages. The cart on the right is filled with potatoes, which are a type of tubers, which demonstrates that Mycobacterium tuberculosis resides within these granulomas of broken down necrotic macrophages. Before moving on, let's first discuss primary infection symptoms. Contrary to popular belief, primary infection doesn't present with much more than a prolonged fever and is most commonly in children, in areas that are endemic